Hello, we are talking today with Yuliya Levina. She's the psychologist and she is managing the anxiety clinic in Barrie, Ontario. And we also have Victoria. She is my co-anchor, right? Hi. So the first question is, why did you call your clinic anxiety clinic? It's a little bit not usual name for the clinic, isn't it?
Hi, everyone. I just wanted to mention just a little note here. I'm not a psychologist. I'm a psychotherapist here in Canada. We have a little bit different licensing, and I'm not a manager in this clinic. Actually, founder and clinical director, and practicing psychotherapist. So I founded this clinic. Why anxiety? Because it's very specific, and because to my mind, as a active clinical practitioner for the past 12 years in Canada, it's another pandemic, anxiety in children, youth, adults. So I wanted to make something more specific. And Barrie Anxiety Clinic, Barrie is the city where I live and where the clinic is situated, Barrie, Ontario. So it's just something that people can see and right away know what it's all about, right? So it's a family mental health center, Barrie Anxiety Clinic. So don't need to dig further. It's pretty clear what we do here.
But how do you know that someone is anxious? Like, oh, I have an anxiety. I have to go to this clinic. What's your definition of anxiety? And how can you tell between normal reaction to the challenges of the life and something abnormal that needs therapy?
Right. Good question. So everyone's definition of anxiety is different, except our clinicians who have very specific definition. So when a person feels like his worry goes into anxiety. So what's the difference between worry and anxiety? Anxiety includes physiological symptoms, physical, how your body reacts. It's not only you worry about what's going to happen tomorrow, you're thinking, you're overthinking. You also have physiological response to your own thoughts or external triggers like news or certain events in life. You have such symptoms as heart palpitation, you have increased blood pressure, you have shallow breathing, you have sweat in palms. So this is some sleep problems. It's number one, right? We cannot fall asleep because the moment all the stimulators of life has gone, we are in our bed, like trying to fall asleep. That's how we start overthinking and we cannot fall asleep, right? So, and when worry intervenes with people's lives, right? When we get sick more often, when we less resilience to stress, when we get more irritable and angry, we snap and people we love, we can't fall asleep. Our academic or social or sport performance is going down. So that's the time people realize it's time to seek for help.
Mostly that you described in the beginning, it sounds like panic attack.
It's different. No, actually, yeah, it's a misconception. Some people, again, because unfortunately, this is not being taught at schools, where I'm a huge advocate for a basic psychoeducation at schools for young children, for teenagers. And I'm doing my best. I don't know if I can break the system or not, but I'm doing my best with free workshops and psychoeducation, individual and group. But it's different, right? So panic attack is something very short. It comes from nowhere usually, and it's triggered in your brain. So not as much with your thoughts, but it's something neurological that your neurons are fired and got, your brain reacted on something that we may not even know what's reacting on. And suddenly I have this, I cannot breathe, right? I have severe chest tension. I have severe heart palpitation, severely increased heart rate. And what makes it different from anxiety attack is I have a feeling that I'm about to die. I'm actually dying. So, and I'm dissociating from the reality. I don't know what's going on around me because I'm already halfway to heaven, let's say, right? Because feel that I'm dying, right? Also, panic attack is very short. So I usually teach, not usually, always, someone with panic disorder or just random panic attacks. First step is to learn how to calm your body down, how to stay, grounded, what things you can use, what tools and strategies you can use to calm yourself down, not to exacerbate that sensation of a panic attack. Because usually the worst thing is anticipation of a next panic attack to happen. That's how anxiety disorder may actually develop. I'm worried that I'll have another panic attack during an important meeting or a date or at school or all this kind of stuff. So that's the difference.
Any questions, Victoria?
I just wanted to say that it feels so true to me because I actually have a panic disorder, and I'm actually taking my ADs to cope with it, and I also go to a psychiatrist to cope with it, and like it's the worst feeling ever. And I also have a question to you. Should we divide, like for example in the university, should we divide psychologists and psychiatrists and people of your profession into, for example, an anxiety psychologist, a depression psychologist, and etc.?
So it depends. So as long as we have, maybe a little bit different here in Canada in terms of regulations and stuff, psychologists in certain countries, let's say Russian-speaking countries of like ex-Soviet Union, it's a little bit different profession than here. Not profession, regulation, bureaucracy, and all this kind of stuff. So as soon as we get in our license, good psychologists or psychotherapists would be choosing the path that they willing to work at, that they're willing to walk on, right, in improving their skills. And so we're kind of like choosing our population. If I choose, for example, work mostly with like kids and youth, teenagers and their parents, so some other, and anxiety disorders, some other psychologists would not. I think not legally dividing them, but I think every therapist, every practitioner should choose the niche that they're good at, that it will be specific, and it will make them develop their skills even further. Because I don't believe in just, okay, I got my diploma, I'm good, I'm a psychologist, right? And the next 10 years, 20 years, I'm practicing the same stuff. That's not how it works, because time moves on, right? I still have psychiatrists, psychologists who practice theories that, where, I don't know, psychoanalysis, treating depression and anxiety and very much neurological disorders that connected to physiology, they're still treating it with psychoanalytical theory and stuff, right? Which may be good, I don't know, but here we're more like practical skill, like, solution-based approach. Yeah, so I think it's up to every good, ethical, reliable therapist and provider to choose their niche.
Yeah, that's a really good point. I ask you because here in Russia, I didn't really see any that any psychologist or psychotherapist or psychiatrist, they actually divide themselves into different disorders. Like they may divide themselves into like family therapist or children therapist, but when it comes to different disorders, they just like, I work with like almost all of them, like depression, anxiety, and yada yada yada. They do not divide them.
Because you know what, maybe so there is a reason for that. Is if you put aside the ethical part and self-development of a therapist, many of psychiatric disorders are interconnected, co-occurrent, right? We call them comorbid disorders. So for example, majority of people with anxiety may eventually develop depression, right? So it's kind of coexistent conditions, or kids with ADHD, oppositional defiant disorder. Quite often I see so much misdiagnosis where okay, the kid is diagnosed with ADHD, but it's actually anxiety disorder, like generalized anxiety, right? Or problems with sleep, or gaming disorder, or like online gaming disorder, right? Overuse and addiction, right? Of gaming. So the kid doesn't get enough sleep. So it's, yeah, because they quite often come together. So that's why it's like, I cannot work with people with anxiety. And then I recognize that, okay, they have, let's say, a depression, or they have substance abuse, or digital disorder, right? Digital addiction. I mean, and I have to refer them to another therapist. That's not going to work because, again, it's more hassle than help to a person.
Mm-hmm. So did I get it right? So for example, when a person with depression comes to your clinic and says, I may have an anxiety, and you figure out that it's not anxiety, it's depression, you send him to another clinic?
No,
Is
no,
that
no,
correct?
that's what I'm saying. That's why
Oh,
we
yeah,
don't
okay,
divide.
Cooccurrent.
Yeah,
Okay,
don't
okay,
divide
gotcha.
into disorders, because also if you like, for example, my clinic called bare anxiety clinic, but also it states that we work with almost every co-occurrent disorder, the simultaneously present disorder, right? Because we cannot divide them. It's a family mental health clinic. We want everyone here, like you have family doctor here in Canada, like we have family doctor, dentist that you go on the regular to checkups, right? That's the idea of the clinic. You don't have to wait for a year to get an appointment. And if you have other family member who needing help, which always also happens with like families with kids, right? Yeah, they just come here for everything basically, because I have different therapists, right? It's not like everything, right? I have different therapists who work for me who specialize in different, let's say I have a perinatal therapist, nurse who works pregnant women and little babies, right? Or I have a dietitian, I have occupational therapist. So yeah.
If you were to set up a program at school, what would you teach the children? I mean, the psychological aspect.
Yes. So what I would teach, I would use my program that I created I have a program here based in my clinic for now. Hopefully we'll grow, we'll get another bigger place for girls that call Girls Confidence Club, because I have this idea of breaking the cycle, intergenerational cycle of trauma. So we, raising, caring and loving mothers, right? So girls, plus girls, it's in the men's world. So anyways, I created a program that's CBT based, cognitive behavioral therapy based, specifically for certain ages based on their developmental stage, right? If it's preteens or younger teens, teenagers, and it's CBT based program. So I would use the same program at schools, basics of CBT, of cognitive behavioral therapy. How it looks like, cognitive part is focusing on our cognition, basically what we think, right? So those patterns of thinking that we developed since we were born based on the environment that we were growing up and our parental, availability, approach, adversity, traumas, experiences, whatever we went through, that shaped the belief about ourselves, our belief about ourselves, about the future, about the people around us, right? So those patterns of thinking quite often are toxic. And that's most of the time what creates anxiety feelings, social anxiety, right? I'm not gonna come say hi to this girl or boy because I feel I'm not good enough, right? Or I feel big because my mama always tells me you have to be slim to get a husband, and all this kind of stuff that parents put in our kids, in our brains, those quite toxic thinking patterns that eventually create a certain psychological deviations from the norm, right? So learning what those patterns are and changing them from assumptions and mind reading and fortune telling, qualifying the positive, all this kind of very specific toxic thinking patterns into factual, right? Or positive or neutral, right? So it's cognitive restructuring of those toxic patterns that make us feel weak, scared, anxious, depressed, changing them into facts, right? And or changing them into thinking rationally or neutrally or positively about the facts. So if the problem arises, I have a test exam, right? And I feel I have such a test anxiety. I know I'm going to fail. I'm going to fail. I'm going to fail. I'm going to fail. Why I think this way? Because I know if I'm going to fail this test, I'm going to come back home and my parents going to punish me for, I don't know, getting B, not A, let's say, right? So I developed this physiological fear of failure, right? So, and what happens, I go to the test because my body is already wired on that fight or flight mode, anticipation of a failure. I cannot actually do this test right because my cognitive functioning is impaired by this fight or flight mode that my body is going through because I'm anticipating the punishment. So I go and I fail the test, not all like I'm getting a B or C lower grade, right? Instead, I know test is coming, but what I can think, we can replace this toxic thought of I'm going to fail, I'm not good enough, into I'm going to do my best. If something's going to go wrong, I'm going to learn from that experience. Next time, I'm just going to fix it. So it's a rational problem-solving approach to events that seem to be stressful, but they're not actually life-threatening, right? So it's an example of how cognitive restructuring in cognitive part of CBT works, and behavioral part of CBT is what we do with our behaviors, basically everything. If I feel scared to go hang out with people that I want to hang out with, or if I'm afraid to apply to this job or ask for promotion because I think I'm not good enough, and instead I'm drinking or I'm spending hours and hours online or Facebook or video gaming, avoiding, right? I'm avoiding behavior. I'm exercising, avoiding behavior. Right? So we're changing behavior here. When it comes to depression, how do we replace coping skills, coping mechanisms with something more healthy, right? Instead of avoiding, you're going to go to the gym, or you're going to go on a walk, for example. Instead of drinking a bottle of wine, whiskey, whatever a day, you're going to, stick to Friday nights, a glass of wine, whatever, right? So in terms of anxiety, we usually, in terms of the behavioral part, we use exposure therapy. So instead of being worried that you're going to fail this interview and you're avoiding asking for promotion, we're actually going to get you being exposed to challenges of the interview and train your brain not to react to this trigger.
I have a kind of philosophical question.
Okay.
Why do you think that human psyche is so fragile? Like comparatively small threats are causing hyper reactions. How could evolutionary process permitted us to be such fragile creatures in terms of psyche?
Mm-hmm. I think a big part, first of all, I didn't think the psychic is fragile, right? I think it's fragile, it's artificially fragile, right? Because of what's happening in the environment, intergenerationally, again, I'm talking about, few centuries, right? A couple centuries, let's say the last one, right? So we're very much wired on negativity. We're very much wired on achievements, performance, survival, especially Eastern Europe, right, or Middle East, so countries where intergenerationally we've been exposed to a lot of trauma and adversity, like wars, First World War, Second World War, Holocaust, genocide, like all this kind of stuff. So we got wired on perceiving our surroundings, our future as hostile. That's why we need to survive. So what happens is we created generations of emotionally impaired people, where if I feel angry, I cannot express my emotions if I'm depressed because boys don't cry, right? So we have now fathers who the only way they can express their emotion if the child is not listening is by yelling at them or exercising their authority or using passive aggressive manipulative kind of style of authority, of implementing the authority. And then they go into addictions to cope with their anger. Why? Because it wasn't okay to talk about emotions. We have to survive. We have to get, breadwinner or go to war or, raise children, all this kind of stuff. So that's why I think it's just our psyche is not as trained because our emotions are not used as much. Right? We don't, here in Western world is a little bit different because less adversity here, right? So I find Canadians much more, and I work mostly with Canadians, our community as well, but mostly with Canadians. I have about like 10, 12 years to compare. Canadians, they're more open to discussing their issues, whereas our men especially, right? I feel so bad. I feel like you traumatized. Now you have anger issues because you be traumatized as a child, and now you're hurting people around you, and you don't want to get help for your trauma. Instead, you're raising a child who's already afraid of you and will pass along intergenerationally the character, the lack of resilience, the weaknesses that you're exposing by being dominant over a child. Right? So I don't think we're weak. I think we're not taught how to be resilient. That's why we need to teach kids at school. That's why we need to teach our kids at home, right? It's okay to be a failure because that's how you learn. Okay, you fail. Okay, what our parents do, I'm punishing you for failing. I'm punishing you for you expressing your emotions, right? how we can do it differently. We all experience emotions. My 15-year-old son, I'll give you an example. He got frustrated because he made a mistake, that I warned him a couple of times about schoolwork and stuff. So eventually I had to take his devices away for a certain period of time, but he got very upset. And because it was immediate reaction, first and last time in his life, he punched the wall. It was immediate reaction because I know how the teenage brain works. I'm a teen therapist. Of course, I didn't punish him. I just came. He was scared. He was looking at me with this tremendous fear in his eyes that he's like something bad is going to happen, right? And when I came into the room and said, "Are you okay?" And he, Mama, I'm going to fix it. I'm, sure, of course you're going to fix it. Okay. Are you okay now? Are you calm? Hold on a second. So what happens is like, okay, let's go. I have half an hour. Let's go to Home Depot, right? Let's go. It's a construction store, right? Now you have 5 minutes to research online on YouTube how to fix the drywall, right? And what tools do you need? Your tools you have everything. He's very handy, but he never fixed the drywall. And what we did a learning experience out of it. So what happened is while we're going to the Home Depot, buying all this like Mazuki, the stuff to fix the drywall, we had a conversation. What did you feel? How did you, like what? And I don't know, something happened. He said in my mind, I just needed to, this energy, give it away somewhere. I was so pissed because I had a game planned with my friends. So we had an absolutely amazing conversation. He came back home, he fixed the wall, he spent 2 or 3 hours fixing the wall, right? He learned from it. He'll learn from our conversation. He'll never do it again. Why? Because he doesn't want to spend 3 hours fixing the wall, right? And so he will probably be more mindful. But gratefulness that he was so grateful. And he told me after, Mom, thank you for not snapping at me, for not freaking out. But that fear I will never forget in his eyes, because he never did that before, So that's an example how we can learn from adversity, for failures, from this kind of stuff. So kids become more resilient. They have less fear, but more rational approach to problem solving.
This is amazing example that you just gave us. I would like to thank you for giving us this interview. It was very, very interesting and insightful.
My pleasure. Thanks for having me.
Thank you.